Thank you for inviting me here today. Lots of people are going to talk about policy and research findings, drawing on study data and other resources, and I'm not going to do that. Instead, I'm going to provide some personal reflections, my own and a few of my team positioned in the charity sector. I would have liked to have spoken with somebody else today. I always speak with a peer researcher, but unfortunately you've just got me because they were all busy and couldn't come, but I apologise about that. So I think taking a personal viewpoint is quite appropriate with this topic, and also because the organisation I founded with my husband and I run is all about people, focusing on people. Their stories, history and ambitions, and definitely not pathology. Understanding the complexity of mental health and mental health problems. We should never forget why we do research. We're a research organisation, but we do it to improve things for people, for systems and communities. So at McPin, as the slide kind of summarises, what we're really about is trying to put the voice of personal experience into all aspects of research, and whether that's coming up with the research topics that we do, collecting data, analysing, writing up research findings, disseminating, standing up here giving talks like this. We believe that the people who know most about poverty, pills and pathology and know what the impacts are the person living in poverty and the person taking the pills. So we really put an emphasis on experiential expertise in everything that we do. Now, I was given quite a tricky topic. When I said I'd speak on this impact on mental health on communities, I said, yes, great. And then when I started thinking about it, I realised how complicated it is. So as a charity, our mission is very relevant to that topic, because I was asked, as I said, to reflect on how communities are affected by mental health problems. And our mission is to ensure that research is delivered so that people's mental health is improved in communities everywhere. And what it doesn't say, but what we do actually mean as well, is that we do our work so that communities change too. Being able to respond by providing support and benefit from the mental health of those living and being in them. This interaction between the individual and the collective is very, very important. So as I said, I wanted to provide some personal perspectives, and I don't want to say too much about me. Some of you know me, but I think that my reflections are shaped by a few key things. So firstly, I'm a geographer. I did a PhD at the University of Nottingham many years ago, and my PhD was on mental health and community. I was interested in communities of interest, such as faith communities, education, leisure, neighbourhood, and maybe there are a few geographers here today, but the topic of thinking about community and mental health very much kind of plays to the health geographer, and our interest in people, place and time. So secondly, I was asked to give this talk because I work in the voluntary sector, and I've done that for many years. I used to work at Rethink Mental Illness, and obviously I now run the McPin Foundation. And I think that we need a much, much greater emphasis on what is a major influence on mental health, which is poverty. And I think that a lot of academic efforts are tied to agendas, even if they don't want to be, but they are tied to agendas around diagnosis and medical treatment models. So our work is too often tied to the negative illness deficits. And I am interested in community asset development and mental health in a positive sense, while never forgetting the pain and distress that goes along with this as well. And thirdly, I want to say I'm a mum of 2 daughters, and I have a busy job. And I think that's relevant too to my reflections here. How much time do I spend benefiting my community? Be that a community of family, workplace, school, for my kids or my local neighbourhood? How does my own mental health affect my ability to contribute actively as a citizen? Does it matter? I think it does, and again, both at the level of the individual and the collective, I think it really matters. I just want to pause a minute about language. So this conference is called DeStress, and we've talked about health. Jessica's talked a lot about health. And I think it's really important just to pause, because the way we describe things is part of the cultural scene setting of things. And I've used the term mental health, other people use the term mental illness. I've just put a few terms up here, well-being, etc. We struggle at McPin. As a voluntary sector organisation, we struggle with language. People can choose to describe themselves how they like, but as an organisation we have to pick, we have to choose terms to use on Twitter, to write in documents, to put on our website. And I think it goes to the heart of mental health, which is complexity. There is no one term, you always offend somebody, but it's always good to keep reflecting on and thinking about the language that we use. And I think it's the connectivity and the conceptual overlap between the different terms that we use is very, very important, and I'm sure that will come up within the conference over the next 2 days. I I think mental health, both at an individual level in terms of yours and my mental health, and at a system level in terms of how we respond to mental health problems, has a massive impact on the places we live in, we work in and we play in. And I don't think we probably give enough thought to that, the impact. And like housing security, employment opportunities, health is a fundamental part of everyday life, as we've heard from the previous speaker. Our health shapes us and our surroundings. And these influences are bidirectional. And what I'm going to do in the next few minutes is just give a sort of few reflections on that from my perspective. And I decided, because I know lots of people will be talking about data, that I would use pictures. So I have chosen a few pictures to try and explore some of these reflections that I've got. And I realise that these might resonate with you differently. You might look at these and think something very different to me. But this is my thinking. So I start with connecting people. As people, we are connected to each other, and we're connected to the space in which we live, work and play. Mental health problems don't only affect one person. And as a colleague of mine explained to me when I asked for input for this talk, so I emailed the whole of my team and said, right, I've got to give this talk, what do you think I should talk about? And so quite a few people gave me some pointers. It doesn't just affect us all. As one person said, I know how strongly it radiates outwards from the person and the profound impact it can have on the lives of those around them. And that got me thinking about the pebble. Like a pebble, our mood and the mood of the community have far-reaching impacts. Communities are shaped by the people in them and the relationships they hold with each other. And they're shaped by the activities that go on in them. None of them are uniform, heterogeneity reigns, but some are more powerful than others and can have distorting impacts. But they might also help provide some solutions. I led a research grant a few years ago with Richard Ping, and we looked at the resources in people's networks. We didn't look at pathology at all. We didn't measure any clinical dimensions. We were interested in people, their lives, what was going on in them. And we call these well-being networks. And this was a cartoon that was drawn for us to try and help illustrate some of the work we did. And in people's networks, they contain things that the individual felt was good for their well-being, which is the green, poor for their well-being, which is the red, and the neutral stuff that's in all of our lives that doesn't really, for the individual, feel like it was important, but it wasn't impacting on well-being. And my reflection when I was thinking about this is that what we didn't ask, we're really interested in the impact and unearthing these resources in individuals' networks, but we did not think about the impact on communities of the potential resources in individuals' lives, and thinking of completely reversing it the other way around, and we could have done. For example, by changing the culture of a community centre, as it develops better inclusivity practices in response to the needs of people with mental health problems, you're changing that community, you're changing the ethos of that place, and it then has a spread effect for everything else. The pebble works in different ways. There are lots of potential in Dominic's network and the community around him to influence each other and shape each other, and we need this holistic view to progress our thinking around mental health. So, my next feeling, I've talked about connecting people. I want to talk about the impact of mental health on community in terms of shaping spaces, the spaces we live in. So we have psychological informed environments, and upstairs there's a really fascinating exhibition on which talks to this point around built environment and health. We all know that people are planning to create things around our various psychological needs, and our hospitals, offices, homes are adapting to modern living and contemporary needs, including our health needs. Also, culturally, places are changing too. By putting up an image like the Samaritans thing, we're in your corner, you're changing that space. You're changing the mood, you're changing how people think about that space. So we've got a lot more great awareness around mental health, and the conversations that we're having and overheard around mental health are much more common now. There's imagery in posters and TV, and there's people popping up, and there's, if you stay up late at night working like I do, I find loads of mental health programs on various channels of people talking about bereavement or the impact of various different life events. But it feels that it's a lot more common, and therefore it is shaping the way in which we think about these things, and the community is helping to do that with some of the imagery. We also experience places with risk. So the Samaritans picture here is also important because we become aware of high suicide rates, and we're told where some of those are. And the response from sort of the prevention response is, trying to prevent loss of life by putting that up close and central. And some countries do that really using quite powerful imageries, and others more subtle. But these things are shaping the way in which we live our lives, and we're also shaping our identity of our community. So I think, we do know that where we have places where they're, so-called, the sense that they're run down, there's high levels of poverty, these places start to describe themselves as depressed themselves. A place is a depressed place. So it's not just the individual that becomes pathologized, it's the place as well takes on some of this language. Community is also responsible for shaping some of the responses. So I think what's interesting with my picture about mental health and well-being is the emphasis on mental health and well-being rather than illness, and not using the word depressed here, but the sense that we also have a responsibility for shaping well-being in the community and making that visible. So no longer are mental health facilities locked away. They're on the high street, they're in schools, and we do have a much greater focus on prevention, even though some of it's been stripped away. But these are positive developments that we should be building on, in my view. I was thinking about people, I was thinking about shaping spaces, and then I was thinking about responses. And so my final picture emphasises the responses that communities are having around mental health. And I think that Grenfell tragedy exposed so many terrible things. And in years to come, I really hope that mental health lessons will be among some that we learn from. How a community and different communities within it, because obviously it's very complicated when you just use the word community, it's further complicated than that. But how the community and different communities within it around Grenfell responded. And the systems and organisations are going to be a very large part to it. This is also something that Times Change have been focusing on. So I've put up this image of an employer pledge, and many of you will know, but basically trying not just to make awareness and try and help us to have conversations and it's time to talk, but also get organisations to change their policies, to think about this unstable employment that we've been talking about, the presenteeism at work, the unstable, the lack of certainty around employment contracts. So having employers pledge to take on board the messages around Times Change are very important. These organisationally, on our spaces around those, can change our responses to mental health, and that's why it's really important that we give it some focus. So I just wanted to end on a sense of a quote from one of my colleagues, another colleague, as a peer researcher working with us, when I asked him about this talk. He said to me, "My local drop-in centre for people with mental health problems was closed due to government cuts. People could get cheap meals there, socially interact with others. The staff were great at supporting the needs of users and helping them with their problems. If the agencies that assist people with fighting their rights to wellbeing, housing, claims, benefits cease to exist, the neediest people are left vulnerable and more likely to end up back in hospital. Communities are struggling to respond around austerity. It's already been raised. Our capacity is being diminished, and that community then feels helpless as well. So the individual is infected, the community in itself is affected. So this impact on communities is life-changing, and at an individual level as well. We need to be thinking about faith communities, sporting, education, leisure, health and neighbourhood as part of the solutions. We need holistic approaches to ensure we can better address the mental health needs of people in communities everywhere. I hope you enjoy the next 2 days, and I hope you come away inspired with some ideas to take forward. Thank you.